Hello everybody, my name is Dr. Brian Langlois. I'm the medical director here at the Pet Pantry of Lancaster County, and as you can see wandering around in the background will be Maverick, our official supervisor as we say here at the pantry. First of all, I want to thank you for bringing your dog in to be spayed and neutered. It really does help with us to control the pet population, as well as make sure that we take care of any potential conditions that could occur in your individual dog that we easily basically eliminate the risk of by having them spayed or neutered. So I do want to thank you for that. As you are waiting to pick them up, I do want to make you aware of some important discharge instructions as well as some recovery instructions for them, and you will be getting this in a sheet form when they are discharged, but it will also have information on that sheet as to exactly where you can find this info on our website in this video, so you can refer back to it if you have any questions. The first thing to remember is that they may be a little grumpy or groggy when you get them home, and that's a result of the anesthesia and some of the pain meds they still may have on board. It can take up to 24 hours for all of the anesthesia to be processed through their system. Now, they're going to be up and walking when they go back to you, but just be aware that, again, they may be a little stumbly, appearing a little drunk, a little bit slower. They may just want to sleep the rest of the evening, and that's okay. That's perfectly normal. Please keep an eye on them if you have long staircases or they're going up and down stairs the first time, just to make sure they don't stumble or anything like that, because that certainly is a possibility. You can certainly offer them a small amount of food and water when you get them home, and this would probably be about a quarter of what you would normally offer them as far as their dinner goes, and just probably about a half hour or so after you get them home, try that. If they eat and drink fine, that's great. You can give them the rest of the food, provided there's no vomiting after that. If they don't want to eat or drink, that's okay too. Some of them just prefer to sleep the rest of the day. They've obviously been through a lot with the surgery, and usually by the morning their appetites are back to normal. If you do notice by the following evening they're definitely not eating or drinking, certainly give us a call or your vet a call. We may just want to check them to make sure that everything's okay. You're going to see a small incision either right along the midline of the abdomen for females or right above the scrotum for males. That is where the surgery is done through. We use all dissolvable sutures here. There are no stitches or staples or anything like that coming out that are going to have to be removed at any point. Everything just heals down on its own and everything dissolves. A little bit of swelling, a little bit of bruising is normal around the incision site, so don't be alarmed by that. You may even notice a little clearish discharge coming from the incision itself. Just keep that clean with a little bit of peroxide. If you do notice a lot of swelling or bruising kind of taking up the whole area or getting worse as the days go on, certainly let us know. We may want to check that back. Sometimes that small amount of swelling that you don't have to worry about can be there for 7 to 10 days after surgery. So, don't be alarmed if you see it, but if you do notice it getting worse, again, over time, certainly give us a call and let us know. Now with males, you may notice a little bit of swelling going on in the scrotum. We do see this from time to time, and it may actually look as if they haven't been neutered. Again, this is not so much of a problem provided the dog does not seem incredibly bothered by it. If they are constantly going after the area, things like that, certainly let us know. We can give you some other medication to potentially take some of the edge off, as well as you may need to acquire one of those what we call e-collars or cones to prevent them from licking back there. So if you do notice a little bit of swelling or bruising in the scrotal area, don't worry about it so much. If you notice a lot of swelling happening quickly, again, or a lot of bruising in that whole area, certainly feel free to give us a call. We're more than happy to check them back and just make sure that everything's going okay. Make sure not to bathe your animal for about the next 5 to 7 days. And again, this just kind of protects the incision site and make sure that everything, stays nice and clean and things like that. If it's a really crazy dog, especially some of the puppies are and things like that, are really rambunctious, we really try to ask that you keep them calm for about 3 to 5 days to help that incision site heal down. Leash walks only. If they are tearing around the house like a lunatic, try to keep them a little bit quiet as far as that goes. I realize it can be difficult sometimes with puppies or very rambunctious dogs, but the quieter you can keep them for the first couple of days, the better the whole area will heal down. It's not uncommon sometimes for us to see a lot of scrotal swelling or sometimes some incisional swelling if the dog is really active and jumping around and running and things like that. So, that's another reason to try to really kind of keep them under control and, try to keep them a little bit quieter. The final thing to go over is the fact that they will be going home with some anti-inflammatory medication. And this is the form of a pill, and the tech will go over with you exactly how much to give and how often to give it. Most courses are about 3 days. And it's important to start this medication tomorrow morning and make sure that you finish it all. And this is basically a general anti-inflammatory with a little bit of pain med in it that most dogs will receive post-surgery. you do notice that your dog seems to be much more uncomfortable, really reluctant to walk, just really down, please give us a call and let us know. We are more than happy to potentially give some other medication as well, as I said, to just kind of help them feel a little bit better, but that's on a case-by-case basis. So if you do have any concerns, certainly feel free to reach out and call us and let us know. The contact info to reach me directly is all on your discharge sheet. The final thing I will address a little bit is licking, and a lot of people have this question, do they need a cone right away? And usually they don't. I would say 98% of the dogs we do not end up needing an e-collar or a cone just because they tend to leave the area alone. A little bit of licking here and there is going to be considered normal because the incision is going to itch a little bit as it starts to heal. So they are going to lick at it because it is going to itch a little bit. If they are constantly going after it and you just have to really pull them off it, and as soon as you do, they go right back to licking it and are really aggressive about licking it, then you really do want to look at potentially getting a cone to kind of keep them off that site. And like I said, there is other medication we potentially can provide you to help kind of take that edge off, from them licking and things like that. So those are the major things that you have to worry about. Again, we do have all of this information on the sheet that you are getting as part of your discharge packet. Please make sure that you give away all of the medication exactly as it is prescribed to your pet. And make sure that if you have any questions, feel free to reach out and call us. You can reach me directly at 717-219-4032. Again, 717-219-4032. If you do get a voicemail, just leave a message. I will call you back. If you have other concerns, certainly feel free to reach the pantry as well at 717-983-8878. Again, thank you for bringing your dog in to be spayed or neutered with us today and helping to control the pet population as well as your pet's own health. And if you have any other questions, feel free to reach out to us. Enjoy your pet tonight. Might be the calmest you see them in a while.